Natalie Ray here with Regen and Aesthetics Concierge of Texas, and today I'm going to talk about the different types of ketamine treatments for mental health. There are two types of ketamine treatments, IV infusion and Spravato, which is a nasal spray. IV ketamine infusions are more common because, through this delivery method, the medication achieves full bioavailability. However, it's important to note that IV ketamine infusions are an off-label use, meaning that they are not FDA approved for treating mental health conditions. Ketamine is only FDA approved as an anesthetic. Obtaining FDA approval typically requires significant financial investment, often costing millions of dollars. Since ketamine has been available for a long time and is now generic, there is no large pharmaceutical company incentivized to fund the approval process for its mental health use. Therefore, it is unlikely that IV ketamine will receive FDA approval for mental health treatment. In medicine, numerous medications are safely, legally, and effectively used off-label. As long as there exists valid clinical evidence demonstrating their safety and efficacy, such off-label utilization is deemed appropriate. Currently, there is a wealth of clinical data supporting the use of ketamine for mental health purposes. Spravato is a nasal spray that was approved by the FDA in March of 2019 as a treatment for depression. The way the makers of Spravato were able to obtain a proprietary version of ketamine and therefore fund FDA approval was by changing its structure. The ketamine administered by IV ketamine centers, as well as the ketamine utilized in hospitals for over 5 decades as a reliable anesthetic, is referred to as racemic. This means that the ketamine composition used in IV treatment comprises two mirror image forms or isomers, R-ketamine and S-ketamine. In the past, there had been uncertainty regarding which form was biologically active and effective, but it is now understood that both isomers play crucial roles and function differently to achieve ketamine's desired effects. Research indicates that IV racemic ketamine is more effective than Spravato, as Spravato contains only the S isomer. With IV ketamine, we can precisely monitor the amount of ketamine administered and the duration of its delivery. This precision allows us to make minor adjustments from one treatment to another, tailoring the dosage to achieve the desired level of effectiveness. On the other hand, Spravato is a nasal spray whose absorption rate varies among individuals and even between applications for the same individual. Due to its variability, some of the medication may not be absorbed effectively. Part of it may run down the throat, spray into the air, or end up on surfaces, resulting in imprecise dosing. Predicting dosing and absorption speed becomes challenging, impacting efficacy. If an individual does not respond to a treatment, it's difficult to ascertain whether it's due to absorption issues or the properties of the Spravato itself. Because both IV ketamine and Spravato are regulated medications, they have guidelines for administration. All treatments must be given in a clinical or medical office, and the patient must be carefully monitored afterwards with both types of treatment. At Regen and Aesthetics Concierge of Texas, we offer medically supervised IV ketamine infusions. Our patients are monitored one-on-one during their infusion by an experienced nurse, and an anesthesia provider is on site at all times in a supervisory role. At Regen and Aesthetics Concierge of Texas, it is our mission to care deeply, encourage greatly, and deliver exceptional results. We offer premier concierge care, regenerating the face, mind, and body.